Hey everybody, welcome back to the channel. I have Ashley with us again. Hey Ashley.
Hey,
So we wanted to jump on. It's a new year. We've been thinking a lot about our projects. We have lots of cool things coming up in 2025, if we're being honest. Cliffhanger for all of you.
yes.
But one of the things we put together that we're so proud of from 2024 is our Pursuing Private Practice course, which some of you have seen our posts and maybe some of you haven't. So Ashley, if you had to give it in a nutshell, what would you tell our viewers about this class?
Honestly, I think it's everything I wanted and needed as I considered starting my own practice. 8 or 9 years ago, as I'm aging myself now, I considered private practice and it just seemed like such a big mountain to climb. I didn't know where to start. I didn't know what a to-do list looked like. I didn't know what an appropriate time frame was. I didn't know all the nuts and bolts. And I think as I've stepped into more supervisory and teaching roles, that's still the case. I still have
Mm,
students and pre-licensed and even licensed clinicians asking me, how do you do it? How did you do it? What do I need to know? What do I not know that I need to
yeah.
know? And then that question leads to another question, which leads to another question. And I think our course did a good job answering all those big and small questions.
Absolutely. So I love that you said this is the course that we all wanted. And I know we've talked about that in some of our marketing of like, this is the course we all wanted in graduate school. And
Mhm.
interestingly enough, this is a course that was built off of content I've been teaching at the University of Denver as a part-time adjunct faculty. This is a course that I think everyone should take at the grad level, but also for our colleagues who are coming from community mental health or working for somebody else, this course is for you. So, quick overview 10 modules, which means 10 layers of content, everything from marketing and ideal client to burnout prevention and contingency plans. Like, we kind of look at the whole lifespan of private practice, starting with how do you set things up, nuts and bolts, as Ashley shared, to hey, what's a pivot in private practice? What does it look like to sell or downsize or move to something else in your business? And so, this course has been taught for a couple years now at the university level and is now packaged as a self paced course. Ashley, talk about the pricing of our course, because I think this is something you and I thought very intentionally about when we thought about the folks that might come in.
Mhm. I think we priced it very well in terms of accessibility. I know a lot of students are facing income struggles, especially as they finish up with their unpaid internships and paying school tuition. And a lot of these interns are now in a private practice setting and they want to know how to continue that. Um, and so you and I very intentionally talked about how do we make this accessible? How do we not overcharge, undercharge, show our worth, show how much work has gone into this, value our expertise, but also allowing most people to be able to pay for this.
Yes, absolutely. So, with the 10 modules, you have about 25 handouts or worksheets that we've included. It has videos of Ashley and I talking about the content, giving it a deeper dive. And it really is meant for early career clinicians all the way to seasoned clinicians who are like, hey, I'm moving into private practice on my own, maybe for the first time. And I have those questions that I don't know what I don't know phenomenon happening there. So we hope you'll check out the course. For group practice owners, people who are doing clinical supervision, we've also been known to help you take a glance at the materials if you're going to give that to supervisees and or make recommendations for consultees. So feel free to reach out. Let us know what questions you have about what is built into this Pursuing Private Practice course. Ashley, final thoughts for our audience as they think about this.
I think my final thoughts are we put together a great package. Like not to toot our own horn, but we really did. We walk through some pretty major topics, but we also provide those handouts for people who are checkbox or visual learners or really want to be able to print something out even and, take notes on their own. I'm just really excited about it.
Yeah, I'm hearing the words like this is one of our pride and joys to put this together for our community, for our colleagues who have asked us these things at a price point that is affordable and maybe even less than having to do 4, 5, 6 meetings with a consultant like one of
Mhm.
us. So we hope you'll
Absolutely.
check it out, share it with your communities, let us know if you have questions about it, and we'll put the link below. Thank you, Ashley, for collaborating on this project with me.